SNAP benefits expire tomorrow, leaving millions wondering how they're going to put food on the table. Today, 2 federal judges ruled that the government must tap into an emergency reserve to continue funding SNAP. It's something the USDA initially rejected that it could do. They both asked for an update from the Trump administration by Monday. For now, SNAP benefits are set to expire on Saturday. Now, this pause is already forcing many families to make tough choices between food and medication. One local community health center is now bracing for the ripple effects from the government shutdown. News 5's Peter Choi explains how they're working to fill that gap.
I spoke with a senior who's on a fixed income and relies on SNAP benefits. What she told me about the impact the pause in November really got my attention. Now take a listen.
I had to take early retirement because I had to take care of my mother who had advanced dementia.
A pause on SNAP benefits is causing a major headache.
To have the basic essentials of food being threatened and taken away is traumatic.
And that financial strain, Carson says, is spilling over into her medical needs.
65 in September, it's decreased even more because of my Medicare premiums of $185, so they took that out, so it's even lower.
So I checked with organization that helps patients who are struggling to pay medical care to see if they're expecting more demand soon.
Pic Vista's chief medical officer says they're starting to hear some concerns from people who rely on SNAP benefits.
How am I going to pay these bills or get medical care or name it if I don't get these funds that I have been expecting?
He says that's where Pic Vista steps in, with services that include...
Well, we provide behavioral health, medical, dental, psychiatric care.
Let's say you're a single mom on SNAP benefits. Because of the pause, you have to pay more for groceries and don't have money to pay for your child's medication. That's where the organization comes in.
If a patient comes in and sees us here at Pic Vista and a prescription is written, they can get it at our pharmacies or they can get it at any number of pharmacies in the community that we have agreements with.
It's a prolonged situation with no clear end in sight, but Pic Vista says they will keep serving patients no matter what. In Colorado Springs, Peter Choi, News 5.